Welcome to the last video of this topic, Basic Pathology Unit 4, first video, Neoplasia. Introduction. Neoplasia refers to abnormal and uncontrolled cell growth, forming a mass known as a neoplasm or tumor. Tumors can be benign, non-cancerous, or malignant, cancerous. Neoplasms arise due to genetic mutations affecting cell growth and differentiation. Benign and malignant tumors. Feature benign tumors, malignant tumors. Growth rate slow, rapid. Local invasion no, well circumscribed, yes, invades surrounding tissues. Metastasis no, yes. Differentiation well differentiated, often poorly differentiated. Examples: lipoma, adenoma, carcinoma, sarcoma. Terminology used in malignant clinical interpretation. Carcinoma, malignant tumor arising from epithelial cells, e.g., lung carcinoma, breast carcinoma. Sarcoma, malignant tumor arising from mesenchymal tissues, bone, muscle, fat, cartilage. Lymphoma, malignancy of lymphoid tissue. Leukemia, malignancy of blood-forming tissues, primarily affecting the bone marrow and blood. Dysgerminoma, malignant germ cell tumor, often found in ovaries. Melanoma, malignant tumor of melanocytes, skin pigment cells. Blastoma, malignant tumors of precursor cells, common in children, e.g., neuroblastoma. Laboratory investigation and interpretation. Complete blood count, CBC detects anemia, leukocytosis, or thrombocytopenia. Biopsy, gold standard, tissue sampling and microscopic examination. Cytology, study of individual cells, e.g., Pap smear for cervical cancer. Molecular studies, detection of mutations, e.g., BCR-ABL and CML. Application of immunological investigations. Immunohistochemistry, IHC uses antibodies to detect specific tumor antigens. Helps classify tumors, e.g., distinguishing carcinoma from lymphoma. Flow cytometry, analyzes cell surface markers, especially in leukemias and lymphomas. Essential histochemical and cytochemical investigations. Histochemical staining. PA stain, for glycogen in tumors. Reticulin stain, highlights reticulin fibers, seen in sarcomas. Cytochemistry. Stains like Sudan black B, myeloperoxidase for identifying leukemias. Introduction to tumor markers. Tumor markers are substances, proteins, antigens, produced by tumor cells or by the body in response to cancer. Common tumor markers. AFP, alpha-fetoprotein liver cancer, germ cell tumors. CEA, carcinoembryonic antigen colon and pancreatic cancers. PSA, prostate-specific antigen prostate cancer. CA125, ovarian cancer. CA19-9, pancreatic cancer. Note: tumor markers are used for diagnosis, prognosis, and monitoring treatment response, but are not specific enough for screening alone. MCQs. 1. Neoplasia refers to a. Normal cell growth. b. New, uncontrolled growth of cells. c. Cell death. d. Repair of tissue. Answer: b. 2. Which of the following is a benign tumor? a. Sarcoma. b. Adenoma. c. Carcinoma. d. Lymphoma. Answer: b. 3. Which feature is typical of malignant tumors? a. Well circumscribed. b. Metastasis. c. Slow growth. d. No invasion. Answer: b. 4. Carcinoma arises from a. Connective tissue. b. Epithelial tissue. c. Muscle. d. Nervous tissue. Answer: b. 5. Which tumor originates from mesenchymal tissue? a. Carcinoma. b. Sarcoma. c. Melanoma. d. Blastoma. Answer: b. 6. Malignancy of lymphoid tissue is called A. Sarcoma, B. Lymphoma, C. Carcinoma, D. Leukemia. Answer, B. 7. Dysgerminoma is a tumor of the A. Bone, B. Ovary, C. Liver, D. Brain. Answer, B. 8. Which investigation is considered the gold standard for cancer diagnosis? A. CBC, B. Biopsy, C. Flow cytometry, D. Immunohistochemistry. Answer, B. 9. Pap smear is an example of A. Histology, B. Cytology, C. Biopsy, D. Molecular study. Answer, B. 10. Immunohistochemistry detects A. Blood sugar, B. Tumor antigens, C. White blood cells, D. Bone density. Answer, B. 11. Flow cytometry is mainly used in diagnosis of A. Sarcoma, B. Leukemia and lymphoma, C. Carcinoma, D. Dysgerminoma. Answer, B. 12. PA stain is used to detect A. Lipid, B. Glycogen, C. Collagen, D. Keratin. Answer, B. 13. Which stain is used for reticulin fibers? A. H&E stain, B. Reticulin stain, C. PA stain, D. Myeloperoxidase stain. Answer, B. 14. Tumor marker AFP is mainly associated with A. Breast cancer, B. Hepatocellular carcinoma, C. Colon cancer, D. Lung cancer. Answer, B. 15. CEA is a tumor marker mainly associated with A. Colon cancer, B. Lung cancer, C. Ovarian cancer, D. Bone cancer. Answer, A. 16. PSA is a tumor marker for A. Lung cancer, B. Colon cancer, C. Prostate cancer, D. Breast cancer. Answer, C. 17. CA-125 is elevated in A. Pancreatic cancer, B. Ovarian cancer, C. Liver cancer, D. Bone cancer. Answer, B. 18. Tumor markers are mainly used for A. Confirming diagnosis alone, B. Screening alone, C. Monitoring and prognosis, D. Vaccination. Answer, C. 19. A rapidly growing malignant tumor is usually A. Well differentiated, B. Poorly differentiated, C. Encapsulated, D. Non-invasive. Answer, B. Hey guys, if you like the video then subscribe the channel and make sure to, I'll share the video. Let's make 1K subscribe. Thank you.